I'm a psychiatrist in San Francisco with a mostly psychotherapy practice. I was a published psychotherapy researcher early in my career, and for decades I've taught psychiatry residents, that is, doctors specializing in psychiatry, about psychotherapy. This video starts a series on psychodynamic psychotherapy, what it is and how it can help. I'm Dr. Stephen Reidbord, and this is More Than Meds, where I talk about psychotherapy and psychologically informed psychiatry. Most of you have heard of Sigmund Freud and his invention called psychoanalysis. It's a very intensive treatment where patients lie on a couch several times a week and free associate. They say whatever comes to mind without censoring themselves, without holding anything back. The analyst sits out of sight and mostly silently, occasionally making comments to help the patient gain insight about what's going on in their own minds. Psychoanalysis is a word that's so ingrained in our culture that it's often applied to different types of therapy that really bear no resemblance to actual psychoanalysis. So just venting, getting things off your chest, that's not psychoanalysis. Just getting advice or tools or strategies for managing your feelings, that's not psychoanalysis. But very early in its history, a less intense variant called psychodynamic psychotherapy was born. And that's what we'll talk about today. Psychodynamic therapy is less intense. It's only once or sometimes twice a week. And everyone sits in chairs. There's no couch. It's more of a conversation. But psychodynamic therapy does share the basic principles of psychoanalysis. And here are some of what they both believe. First, there's a dynamic unconscious. Even though some people debate this still, the evidence for this is overwhelming. When you forget an appointment that you really didn't want to go to, or can't come up with an idea or a word because it's disturbing you inside, that's the dynamic unconscious at work. When we talk about somebody compensating, right? A person blustering and making a big show of themselves when we think that really they're insecure inside. That's the dynamic unconscious at work. Another thing that is important in psychoanalysis and psychodynamic therapy is childhood. And that's because our personalities originated when we were young. We don't focus just on childhood for no reason at all, but frequently a discussion of one's personality or general approach to life starts with childhood. So often that's one of the topics that is discussed in this therapy. Another principle is that we get in our own way owing to non-rational unconscious forces. And that usually there's a kind of pattern to this, that it isn't limited to one specific relationship or one specific setting, but the things that get in our way tend to be pervasive, tend to go across different situations because they're parts of our personality. For that reason, in psychodynamic therapy, we look for recurring themes, typical patterns in the person's life. We use defense mechanisms to avoid painful thoughts, feelings, wishes, impulses, fears, and that these take all sorts of different forms. Just changing the subject when things get uncomfortable. That's one way to do that. There's also classic defense mechanisms, some of which have become common language when we talk about someone projecting, for example, putting their own feelings on somebody else. That's a classic defense mechanism. Or if you see somebody who's all red in the face and tense and yelling and banging their fist on the table and saying, "I'm not angry," they're in denial, right? Denial is a defense mechanism. Another basic principle of psychoanalysis and psychodynamic therapy is that the therapeutic relationship itself is healing. In another video, I talked about how learning to be a psychotherapist in this tradition is less about what you do and more about how to be curious, how to be relatively non-judgmental, how to be accepting. Also, the therapeutic relationship can be pretty revealing as well, because the same dynamics that arise in all the other areas of the patient's life often arise in the therapy relationship too. But there, it can be observed in vivo, so to speak, making the therapy a kind of laboratory or microcosm of the patient's life. The terms transference and countertransference enter here. Transference are the feelings that the patient has towards the therapist, and countertransference are the feelings that the therapist has in response to the patient. Paying attention to the transference can shed light on the way the patient views themselves and also views other people. And last but not least, there's insight. As Freud famously said, making the unconscious conscious. But it's important to emphasize that this isn't intellectually understanding something, but it's feeling it in your bones. It's recognizing something about yourself at both an intellectual and an emotional level. That's what true insight is about. Because psychodynamic therapy deals with the unconscious, it's really best suited for mysterious self-limitations. When a person sabotages themselves, they set themselves up for failure, even though consciously they don't intend to do that. When there's a lot of wasted potential, not finishing projects, not having a fulfilling career, setting one's sights too low, picking fights with friends and family, the people closest to you, causing conflicts or just destroying relationships at work or at home. Why would a person do these things where they get in their own way, they make their own life less happy? That's what psychodynamic therapy aims to find out. So how does this work? Unlike some other types of therapy, there's no agenda, no cookbook, no series of steps. It isn't like you do one thing on session 1 and you do something different because it's session 2 and something different because it's the next session. Instead, it's more like a playground. The creation of a safe setting where all of these thoughts and feelings and wishes and fears can be looked at and explored without damaging the patient's real life outside of therapy. For example, you can have murderous thoughts and violent fantasies in psychotherapy without actually hurting anybody. What the therapist mainly does is set up the safe conditions, the playground, so to speak, so that all that can be explored. And then to be a playmate, to work with the patient in that setting to deal with all of that arises. Or to use a more adult example, it's like the patient is in the driver's seat in a car, and they can control steering the car, they control the gas pedal and the brake, they can decide to steer towards a topic or change the subject, steer away. They can decide to hit the gas pedal and talk more about something and really get into it, or hit the brake and stop talking about that. The therapist is not in the driver's seat. The therapist is in the passenger seat, but pointing out the window at curious, interesting, maybe helpful items in the landscape that maybe they can drive to. Hey, look over there. Why don't we drive over there and take a look at that? The patient can say, sure, and drive that way, or hesitantly go, well, if you say so, and then drive there, or no way, man, I'm going the other way. The aim is to explore as much of this mental landscape as possible to make it familiar territory, or at least for both parties to understand better why the patient won't explore certain areas and steers away from them. In doing this, the inhibitions and fears and avoidances are brought into consciousness. The patient can see what's going on. And in that process, those tend to lose their power. A person can look at them more objectively. They can use their conscious mind to steer themselves in one direction or another better than they could before. Some unhelpful habits, like avoiding certain topics or feelings, just prove to be unnecessary, and the person can gradually let them go. This is often a process that takes time and some repetition, looking at the patient's relationships, their feelings from all different angles over and over again to get new insights about them. That's a process that in psychodynamic therapy and psychoanalysis is called working through. Meanwhile, the therapist accepts all the patient's thoughts and feelings and impulses, even ones that wouldn't be acceptable in everyday polite society. In modeling this acceptance, the patient too learns to accept aspects of themselves they might not have accepted before. Therapy is usually a balance of changing things in yourself and also learning to accept parts of yourself that were previously unacceptable. I did a video specifically on that you could take a look at. Psychodynamic therapy really addresses both sides of this, changing yourself and also learning to accept yourself. The benefits of psychodynamic therapy often go beyond the relief of symptoms like feeling depressed or feeling anxious. Afterwards, patients are often more comfortable in their own skin, more comfortable in their relationships. They don't get in their own way as much, more satisfied with life overall. The way these global improvements happen is by not focusing specifically or mainly on the troubling symptoms like depression and anxiety, but looking more globally at the person's personality. If you think about it, your personality affects everything in your life, all of your relationships, all of the situations you're in, all of your attitudes. For that reason, psychodynamic psychotherapy often leads to subtle but pervasive changes throughout a person's life. But many people do seek psychotherapy for specific complaints. Depression and anxiety are the most common. In a previous video, I talked about how there's kind of a choice to try to get to the root of those issues, what lies underneath depression and anxiety through psychodynamic therapy, or alternatively to treat the depression and anxiety itself without looking at the causes through medication, for example, or symptom-focused treatment like cognitive behavioral therapy or CBT. But there's more to say about how psychodynamic therapy helps depression and anxiety, and those will be the topics of the next videos in this series. Please share your thoughts in the comments, and please like this video, but only if you really like it. Please subscribe if you have not, and you might want to check out this video, which is on different kinds of therapy and what's best for a given individual. See you next time.